What's up, YouTube? What's up, internet? Using my time, trying to use my time productively, trying to have some type of product in the world. Today is really sad. I have to say rest in peace to my mice. They died in my care, in my hands. I take that really, really seriously. If you're not sure if you can care for an animal or you're unsure, I would strongly recommend do not try to purchase one. It's really, really sad and horrible thing to have an animal die in your care. That being said, I'm doing a quick video today on head injuries. All right, I know there's a lot of techniques, strategies, and theories on concussions and severe head trauma. And when I was 12 or 13, I fractured my skull. I had internal bleeding. I had a subdural hematoma. I had the side of my head opened, the blood drained, and I got 20 staples. No, I never had any physical therapy, and I had it at a young age, so it's usually harder to tell the side effects. And the good thing about having a severe head trauma at a young age is your brain is still growing. So it's not like an older brain or an older person where it might have permanent effects that have much less chance of balance. But one thing that kind of pissed me off about that is that my parents never acknowledged it as a serious injury. They never acknowledged it affecting my schooling, and they never acknowledged it affecting me as a person. They always treated it as something that I should dust off my shoulders and step up and handle. But later on in life, I had another head injury at age 30. It was way less serious. I was drunk when it happened, so I don't know how hard the impact was, but it wasn't as bad as the first one, because the first one, I remember it. I remember the way that the fatigue felt, and I remember the way that the pain felt, and I remember the way that the side effects felt before I had surgery. So as soon as I got this one, I knew it wasn't as bad. After a day, I was in the first one, I was in the hospital within a day, getting CAT scans in the ICU. This one, at first I kind of had that feeling like you could maybe pass away or have an aneurysm in your sleep. And that was the fear of the original. For anyone that's had a head injury or a concussion or a head trauma, they'll understand, they'll know what it feels like. And but this one, I once I got past the first day, I could feel it recovering. I could feel it getting better. I knew it wasn't gonna be like bringing me to the point of the last one, which was near fatal. And I learned, first and foremost, the injury needs to be completely clean. I made the mistake of not thoroughly using disinfectant. I used like natural oils and soap, and there was some type of infection under the skin. I'm assuming some type of bacterial infection. It seemed to be alive. It seemed to be running from my tweezers. It was not cool. It's still present in a small degree. What it does is it like secretes oil onto the top of your skin, which prevents your skin from healing, and it creates this like tadpole for this bacteria to like slide around in. So it might not exactly be running from my tweezers, but it blends itself in to look like a blackhead, and then the bacteria is like moving around. I don't know what, but it was not. Once I pulled it out of my head from underneath the healed skin, which I should have put Neosporin on it right away, but I didn't have any. Immediately I felt my attention span get better. I felt my fatigue go away. So the bacteria in my infection was having a huge role in the side effects of my head, of the side effects of head trauma. So first and foremost, preventative measures against head trauma. The injury has to be cleaned if skin was broken. The skin was only broken on the surface, and it was still, like, if the skin's broken, you need to fully disinfect it, preferably with Neosporin or with the doctor, iodine or whatever. next goes on to physical therapy. So the first one that I had, I just went on with my life. I didn't know anything about motor skills, attention span, hand-eye coordination, anything like that. This one, on the other hand, I got to deal with it myself at an adult age, which was really, really cool, because now I have a more developed mind now. I can fix my own problems, or at least attempt to. So obviously there's exercise. Okay? After I hit my head the second time, I had a full understanding of my capabilities beforehand. Coming into the second one, it was greatly affected. I got tired way quicker. I could barely stay in closed rooms. I could barely stay with closed windows in a car. I could barely, and this is all information for anyone out there. This is not any complaining or griping. This is hopefully to benefit the medical field and anyone that ever has head injury. And in case you don't have access to medical care, or you got to deal with it yourself, this is what you need to look out for and what you need to do right away. It needs to be disinfected and cleaned properly, so you don't have any bacteria getting into your bloodstream around your brain. That's big. That's a big issue. Then physical therapy, definitely helpful. Running, jogging, walking around, pushing your endurance, not your stamina. Don't push yourself to the point of, but long-term endurance. A big star for helping. Second off, attention span games. Maybe it's Clue, maybe it's Checkers, maybe it's Call of Duty Zombies. Something that if you put your time into it, it will be never ending, but it gets harder. That's why I chose zombies. Call of Duty Zombies, the longer you play it, it's never ending. It gets harder. It uses hand-eye coordination. It uses your attention span. It uses your stamina. I mean, you play zombies, you use your fuel in your stomach. You're going to get hungry by the end of it. You're going to be tired. You're going to be legitimately tired. And play it standing. That will do wonders for your brain. It's good for your brain even if you don't have a head injury. Now, I'm not saying go play zombies every day of the week. You don't want to turn into someone who's obsessed with violence. But maybe one good round every day when you're trying to recover for your head injury, try it out. I'm telling you, try it out. Get into it. Next is caffeine and stimulants. Now, I'm not sure how common that is in being. I know the most common one is like stretches and physical therapy and attention games, but stimulants, wow, I've always had an issue with stimulants. Coffee, mostly caffeine, mostly energy drinks. I never some ecstasy pills. Now I always use them just so I could focus on work and so I could have a good, be motivated. But what happened after this head injury was I was so fatigued and so tired that I started to try to use stimulants and caffeine, energy drinks, caffeine pills. Nothing stronger than that. Nothing stronger than taurine, guarana, whatever's in those new energy drinks. That's more it's not triple C. It's like a workout set whatever it is. Nothing more than you could get at a gas station with a heavy dose. And I'm not talking about every day I need to chug a Rockstar first thing in the morning. No, if you're recovering from this concussion or from this head injury, you may have gone to the hospital, you may have not. If you did not, you're dealing it with your own care. You need to disinfect it. You need to clean it properly. If you're feeling side effects of it and you're still recovering, push yourself to recover stronger. Choose a day to exercise. Choose a day to play video games, and choose a day to get a strong dose of some type of, stimulant, caffeine, taurine, guarana, caffeine pill, something like that. Take a heavy dose. Drink 2 energy drinks. Don't abuse it. Don't try to get loaded, don't try to get psychedelic on yourself, but take a strong enough dose to where you know it's not for just working or going to school or whatever. And then, you know, drink water, exercise, play the video game. Let that caffeine run through your brain and re-stimulate those passageways, re-bridge those neurons, protons, whatever it is, you know, based on my knowledge. But I felt it. I felt my brain reconnect. I felt it restart to use the corners and patches that I maybe had bonked and bled on, or whatever, however head concussions work. And and then at night, you know, drink slightly to go to sleep, maybe a little alcohol to take the edge off or just drink water and go to sleep. Hopefully you'll be tired. Sleep as much as you can and then get up, and don't go right back into the caffeine. Lay off it, let it go. But look at where you are at mentally. You push your attention span, you push your physicality, and I've walked through 2 pretty bad head injuries in my opinion. The first one was near fatal. And this technique worked wonders. I feel smarter than I did before. I feel like I have better attention span. I feel like I have better self-control. So if anything, this head injury slowed me down enough to re-recover unhealthy methods that I learned unorthodoxly with my first head injury, now that I'm older and more mature. So if you're out on the street, or you're out, you know, living the wildlife, or whatever it is you're doing, and you have a head injury and you don't have the chance to go to a hospital, or you don't feel like you received the proper recovery care, I'm telling you, exercise, patience and attention required video games mixed with doses of caffeine and stimulants, not meth, caffeine, taurine, guarana, caffeine pills, and give yourself a couple days of these 2 things, heavy usage, and then rest, relax, sleep, watch TV, take it easy, sit in the bath, go to the pool, don't work yourself, and let yourself recover. And I can almost guarantee you'll have results. You can even try that without a head injury and see what kind of results you get. Just don't abuse any of them. Don't abuse them, use them. So I hope everyone finds their calling in life. I hope everyone has a purpose, whether it's talking on their phone, whether it's whatever it is that God chooses them to help better our country, whether it's helping animals with animal cruelty, or CPS service, or English second language, you know, helping immigrants learn English because you feel like the system is slanted towards immigrants, or whatever. I hope that you find something honorable besides being mad at people, besides wanting to get revenge, besides having a chip on your shoulder. Because here's a new catchphrase that I learned from some of my best friends. Being mad at the world only lasts you so long, so you might as well try to figure it out, because it usually only gets you 2 things: in jail or dead. Wouldn't you rather enjoy your day? Because there's people out there that, anyways, try not to be mad at the world. It's just try not.